Good evening, ladies and gentlemen. Welcome to another edition of What's Going On in Corpus Christi. It's December 28th, 2017. Can't believe Christmas is over, and I'm going to do this before the 1st and get it out. We've got some scheduling problems with the Channel 10. Not problems, but a little adjustment during the holidays. The air times on this are Tuesday evening at 8:30 p.m., Wednesday at 9 p.m., and there's my Gmail address. It's gsansing@gmail.com. Email me when you can. I love hearing from you and finding out what you think about some of the happenings going on around this place. Anyway, I'll be right back. Okay, ladies and gentlemen, I'm going to play this one more time. They're your local politicians and national politicians and so forth with their little feather in their cap there. And they're talking to you about things, and what you need to do is jump up there with Jiminy Cricket and start shaking your finger in their faces and saying, hey, no more lies, no more delays. Let's get this stuff on, particularly with the city of Corpus Christi. The same thing happens with Del Mar College. You can't really get the truth out of them at times. And they just a bunch of bullies over there, which I'll discuss in a little bit. Okay? But be right back with you. Okay, ladies and gentlemen, the lights are on, camera's rolling. I'm going to go and take my seat and discuss some issues that I think should be important to everyone around Del Mar College and the city of Corpus Christi, county, state, and so forth and so on. And I'd just like to say that this is the Taxpayers Association show. I'm president of the Corpus Christi Taxpayers Association. And let me just give you the times one more time on this show, okay? It airs at 8:30 on Tuesday evening, and it looks like 9 o'clock on Wednesday, okay? There was another showing of this that happens during the week, but we'll not worry about that one too much, okay? And then I do the South Texas News and Review show, which is just after this one at 9 o'clock on Tuesday, and it's before this at 7:30 on Wednesday. Okay, so tune in. Now, one thing that I would like to do is these flowers had long stems and they were drooping over, so I clipped them down a little bit. So if that looks funny, I apologize, Miss Lynn, Miss Connie, and Miss April 23. Now, what I want to do is my number one topic today is the Texas Employees Retirement System. Okay. Now, that's the one that does the health for me, my health program, health insurance, and so forth and so on. And what they've done is they've screwed around and changed the health plans and so forth and so on, and the people who are going to be the providers with that. And they went from a real good company to, I guess, according to the physicians around town, and I know a lot of them, folks, okay, because of my position at Del Mar College and my background in antibiotic research and so forth and so on, toxicology and some other factors, okay, microbiology. Now, I'm very, very disappointed with whoever at the state level picked, and I'm just going to name it. It's Blue Cross Blue Shield, and physicians hate them with a passion, folks, okay? Now, I'm going to say this, and if Blue Cross Blue Shield wants to challenge me and sue me and do all these wonderful things, fine. I am, at this stage of the game, trying to find, and I have talked to several people who are interested in filing a massive class action suit against the state with the Texas Employees Retirement System and whoever the bonehead or boneheads were that switched, so that now we have many, many people that cannot maintain and keep their primary care physicians. Okay? So it hurts me deeply. Now, back in August the 8th of 2017, okay, this came out in the American Statesman, Austin American Statesman newspaper, and it said a big change is coming to the state's main health insurance plans that cover nearly 500,000 current and retired state employees and their dependents. Okay, 500,000 people are affected by this, folks. Okay, on September 1st, Blue Cross Blue Shield of Texas will take over administration of the health plans under a new 6-year $281.2 million contract awarded in December by the Employees Retirement System of Texas. Okay? Now, I don't know if that's a year or what. Okay? Blue Cross and Blue Shield won the contract by underbidding United Healthcare Services Incorporated, which has administered the plan since 2012. And I had no problems with that, folks. It went just very, very well, and most of the physicians that I've talked to around were very pleased with that. I'm interjecting my comments into this. You know, I am totally and completely perturbed, and I don't get perturbed very often. And class action suit against those clowns up there seems to be a real good you know, thing to do, especially if you got 440,000 people that are, you know, affected by this. And, you know, the physicians, I usually wouldn't work with them on other plans anyway, not only through ERS, but other systems. The Employees Retirement System of Texas provides health insurance for an estimated 440,000 people and is self-funded, meaning it establishes benefits and pays claims. But it uses a third-party administrator to manage a network of medical professionals and process claims. Okay? So I would think that the Employee Retirement System of Texas is self-funded. I think that, you know, they've lost their minds and they don't give a damn about the constituents that they have, all of us employees. Under the successful bid from Blue Cross Blue Shield, the state's total cost of the health plan is estimated at about $25.8 billion over the 6 years of the new contract, more than $1 billion less than United's proposal. Okay, now you can undercut that. Now I'm just going to stop right here and say that something that stuck in my mind, and this is true with everything around Corpus Christi, Nueces County, and this state, is everything goes to the lowest bidder. Okay? Now I remember vividly when John Glenn was sitting on top of a rocket being getting ready to take a trip into space as the first American to do so, and he was asked if he had any reservations or any fears about blasting off, and he said, "My greatest fear is that this rocket was built by the lowest bidder." Okay? So go out and look at the streets in Corpus Christi, Texas, and now the health plan, it's the lowest bidder, and I can't go back to my primary care physician that I've had for many years because he said, "No, I'm not going to take less money than I can get with a Medicaid care patient." Okay? So the Blue Cross Blue Shield has undercut Medicare, folks, and affected 440,000 Texans. I mean, it's despicable. Okay, the biggest difference is a lower projected reimbursement rate to healthcare providers in Blue Cross Blue Shield's network, according to analysis of the bids by the ERS. United's estimated administrative fee of $325.5 million over the life of the new contract also was higher than Blue Cross Blue Shield's projected $281.2 million fee. Okay? Now, somebody's really, you know, that's a hell of a lot of money, folks. And the difference there is that for about, you know, half of the people that are under this care, I'll saddle that horse in a minute. Okay, the contract is for administration of the state's Health Select Texas and consumer-directed healthcare Select of Texas plans. Kathleen Tazar, an ERS spokeswoman, said the agency periodically rebids the contract and determined that the Blue Cross proposal offered better value to the state this time. Okay, I think from everyone's perspective, United was doing a fine job. Tazar said there was nothing wrong with their performance. So what in the hell are you doing switching it, ma'am? You know, I've tried to get a hold of the head of the ERS, and you know, they're protecting him pretty well up there, but maybe when I haul his butt into court and sue these people, then maybe somebody will you know, shape up, start calling. Blue Cross and Blue Shield of Texas, a unit of Chicago-based Healthcare Services Corp., has been on the losing end of the rebidding process before. The company has held the state contract off and on for multiple decades and was administering the health plan the last time the ERS put it out for bid when United entered the winning bid. Okay, Blue Cross declined to make a spokesman available for comment, but said in a written statement it was worked closely over the past 9 months to ensure the best possible transition from ERS participants. United did not make a spokesman available for comment. Kate Joannes, I guess that's Jonas, a spokeswoman for the 15,000-member Texas Public Employees Association, agreed with TASAR that United had been doing a good job, but said her group backs the state's efforts to keep health costs down through competitive bidding. The lowest bidder, folks, go out and look at the streets that are in Corpus Christi that the lowest bidder got, and they're still falling apart. Okay? I'm just trying to put you on the same plane. And so if it's the lowest bidder, that doesn't mean it's the best job. And then I'll get into Del Mar College with the lowest bidder too. It's called change orders. Okay? The ERS has made the best choice in terms of providing the most benefits possible at the best price, Joanne said. Okay? We're very supportive of their efforts. Anything they can do to keep the costs low enough for the state to maintain benefits and to keep the spousal and dependent care manageable for state employees is positive. No, it's very negative. We have people here, there is no urology group in Corpus Christi, Texas that will accept Blue Cross Blue Shield. They have a reputation for being lousy, okay? Underhanded and lousy. And then here we hire them as the lowest bidder, okay? Now, there are also many people. I know there's an abdominal group that I've been with for a long time, and they're not going to take Blue Cross Blue Shield. Okay? My primary care physician refuses to deal with them because of not only prior dealings, but because they're a bunch of scoundrels, folks. They're cut rate. Okay? We're going to the discount, center of the world here, the lowest bidder, which is the lowest form of life when it comes to the health and welfare of my fellow Texans, folks, particularly the ones that have to endure this ERS garbage, okay? All right, so the state currently pays 100% of the monthly premiums for most full-time state employees enrolled in the health plans and for many retirees, and it pays 50% of the monthly premiums for dependents. The only change to premiums for the fiscal year beginning September that will be paid by participants is an increase averaging less than 1% for dependents according to ERS. So with that in mind, folks, we're going to deny professional and decent medical care for a lot of people because the physicians aren't going to put up with this garbage. Okay? I don't know if my cardiologist will take it. I know that my abdominal specialist won't, and I was up for a trip over there for that whole fun thing that they do. Okay? And they said, nope, we're not taking it, your health plan. My primary care physician, I saw him 2 days ago, and he said, I'm sorry. He said, I've got an awful lot of people from Del Mar College. You're one of those over there as an employee that I've seen just the same day, 5 or 6 of us, and we can't find a decent primary care physician, folks. And I don't particularly want another person because that man is fantastic. Okay? I haven't talked to cardiologists. I haven't talked to several of the other providers. So this is a big tragedy here, folks. So if you're out there and you're under the ERS system, even TRS with the teachers and so forth, would you let me know? Because I think they've gone through a similar program. I'm getting bits and pieces. But call me if you're interested in a class action suit, and I'm just the guy that can go ahead and step up and do it. Okay? And then here I get this thing on August 24th. Welcome to Health Select of Texas. Beginning September 1, Blue Cross Blue Shield of Texas will manage the provider network, process claims, and provide customer service. The Employees Retirement System of Texas will continue to set the benefits and pay the claims and destroy health care as we know it. Okay, I interjected that one. So this was from the Blue Cross Blue Shield of Texas. Now, then we've got select a primary care physician. You need to choose a primary care physician. Your PCP coordinates your care and manages referrals you may need to see specialists. If you see certain specialists without a referral from your PCP, you will pay more, even if the specialist is in the Health Select network. Okay? So they're screwing you, folks. They're screwing me. All right? No deductible. If you see an in-work provider, you will not have to meet a deductible before the plan begins to pay for your health care services. Preventative services covered. Routine annual checkups and preventative vaccines are covered at 100% when you visit an in-network doctor. Large network. You have access to a network of more than 50,000 doctors, hospitals, and other providers. To keep health care costs as low as possible, make sure all your health care providers are part of the Blue Cross Blue Shield Texas Health Select Network. Okay? Now, and there are a lot of physicians that I've contacted, and they say not no, but hell no. Okay? So I guess I can go to, somebody that's just not quite up to the chore as far as I'm concerned. And I've taught medical school, specialty classes, and so forth and so on. Folks, I know what I'm talking about. I've been around physicians for many a year. I've done research with a bunch of physicians in the antibiotic research business. Okay? I've been associated with postdoctoral positions at medical schools, working on medical things. Okay? We are writing to let you know as of November 20th, 2017, the primary care physician and your dependents have on file with us has not joined the Blue Cross Blue Shield Texas Health Select Network. Provider name, and there's my physician's name. I'm not going to name him on the air, folks. Your in-network PCP benefits for the PCPs listed above will end December 31st, 2017. This means if you visit this PCP after December 1st, out-of-network benefits will apply and you will pay more for services beginning January 1. To avoid paying higher out-of-network costs beginning January 1st, 2018, you need to select a new in-network primary care physician. We are happy to help you select a new PCP. Well, folks, they're not physicians, even if they accept the Blue Cross Blue Shield, are not accepting new patients around here. Okay? What does that tell you? Does that make everybody feel safe? Now, since this is a state agency, the Texas Employees Retirement System, that's your tax money, folks. Okay? So here you are allowing a taxing entity, okay, the state of Texas, through the ERS, to slam dunk a bunch of, about 440,000 of your fellow Texans. I mean, let's get serious here, folks. Okay, it's time to revolt. Okay, I think I'll just try to get enough people up there gathered around the Alamo to see if we can get a good class action suit going against this lousy state entity called the ERS. Okay, all right, and then it goes on. Your in-work PCPs are listed above. No, there is no list. And then what they did, if you or someone you are helping have questions, you have the right to get help and information in your language at no cost. Arabic, Chinese, French, German, Gujarati, Hindi, Japanese, Korean, Laotian, Navajo, Persian, Russian, Spanish, Tagalog, Urdu, whatever that one is, okay, Vietnamese, and it goes on with this list of languages that you've got. I mean, you people at Blue Cross Blue Shield are nuts, folks. Okay? Now it says that if you believe we have failed to provide a service or think we have discriminated in any other way, contact us to file a grievance. Office of Civil Rights Coordinator, I'm in the process of that. United States Department of Health and Human Services, I'm in the process of complaining to them. This is a tragedy, folks. Okay? So, what can I say except you taxpayers out there being messed around again. Okay? And then here's one, a communication from the American Statesman. That's the one I just got through reading most of it to you. Okay? And then there was another one, thousands struggle to find doctors who accept new state insurance plan. This came out of the Channel 10 TV, KFDA, I think it is. Yeah, and that's out of Amarillo, Texas. Thousands of state employees in the Panhandle are having to search for new doctors following a change in their health insurance plan offered by the state. Okay, people in our area who now have Blue Cross Blue Shield Health Select insurance have been calling their doctors only to learn that they will not accept this new plan. Okay, all state employees were switched to this plan on September the 1st. Now they did give me a grace period so I could see my primary care under the old system, and I did that a couple of days ago. All right, the decision was made by the Employees Retirement System of Texas, which is aware that thousands of people in the Panhandle are struggling to use this program and are working to solve it. Some Panhandle residents are now having to travel to see specialists no longer available in Amarillo under their new insurance, which is not easy for most people. And this is quote, we have to rely on going to Lubbock, which is a 2-hour trip, maybe an hour and a half if I drive fast, said one concerned Health Select carrier. My husband, he doesn't get around too well, so I have to take off a day when we go to Lubbock. Some local doctors have already changed their plans to include Health Select coverage, like all Texas Tech doctors, Family Care Clinic of Pampa, and Amarillo Stat Care. Okay, I probably had about 10 calls before starting in July starting in July that they need me to switch to continue to see me, said Kayla Mayberry, FNP-C and owner of Amarillo Stat Care. I found out we were not in network and actually switched my plans with Blue Cross Blue Shield to include Health Select. One health insurance creditor said he thinks more doctors aren't signing up to cover Health Select because they think it's a low reimbursement plan, which it is. I think a lot of providers get confused when they hear Blue Cross Blue Shield, HMO. They think the other HMO product that Blue Cross Blue Shield called Blue Advantage HMO, and that's the product of Obamacare plan, said Brian Williams, president of Moxie Healthcare Solutions. So I think when doctors hear Blue Cross HMO, they automatically assume it's the Obamacare network, and they don't want to take that one on, because the reimbursement is so poor on the plan. Some doctors in Amarillo will not be working to adjust their plans. Amarillo medical specialists sent a letter to their patients, pictured below, stating that they would not be taking Health Select insurance because of the low reimbursement. Okay? And this is from the Amarillo Medical Specialist, LLP, and they won't do it, and it lists the Amarillo Medical Specialist listing of doctors by essentials, a Blue Essentials HMO status, not in network for the ERS Health Select, and then it says not in network for Texas ERS Health Select. And they list a whole bunch of physicians here, and this was William C. Biggs, MD, FACE, Managing Partner, Amarillo Medical Specialist. They said no mas. Okay. Then we have, and I hope I'm not boring you, I've got a whole bunch of feedback from my people at Del Mar College. Okay. Now I sent a note. I got an email from Mrs. Tammy F. McDonald. Okay. And she is the Vice President of Administration and Human Resources for Del Mar College. And they were going to there will be a college-wide meeting on Friday, December 1st, 2017 at 9 a.m. in the CED. That's the Centers for Economic Development, room so-and-so. Okay? And it says the administration will discuss the changes that were made by ERS. Okay, now basically I think most of the employees that were affected at Del Mar College are pretty perturbed with this. Okay, so I sent out a DMC that's to all of the college employees. I have been informed by my primary care physician of many years that he has not been able to arrange a contract with our new health insurance provider Blue Cross Blue Shield. On November 22nd, 2017, after trying for hours to get a contact number, I was able to contact the administrative assistant to the executive director of ERS. She indicated that she would have someone from the health insurance division contact me about the matter. That didn't happen. Okay? I have had no responses. I told her that I was concerned that I am being harmed by having to find another primary care physician and that many Del Mar College employees use my physician. I named him. When will this insanity end? If you do go to my physician and want to have ERS Executive Director contact information, please let me know soon. I hope that the DMC Del Mar College administration will step up and assist us in this matter and advise the members of the Board of Regents also. Okay? Now, we did have that meeting. The press was kept out because of some people, discussing their individual medical things. I don't know if that was kosher or not. I'm not going to comment on that. That's Del Mar's call. And, those attorneys over there and some of the administrators are you know how I feel, okay? And then thousands struggle to find doctors who accept new state insurance plan. And this was sent to me by one of my fellow faculty members. Okay, I'm not going to mention names. Here's one from another faculty member there, a good friend of mine. It says, okay, let's see. He said he's in with what I had sent. Okay, now another one here, and that man is going to have to pay out of pocket tens of thousands of dollars for some of the problems that he has because the specialists around here taking care of him are not going to accept Blue Cross Blue Shield. Okay, and then here's another one. Yes, my family and I lost the doctors we started with when we moved to Corpus 6 years ago, so I could join the Del Mar College faculty. My primary care doc eventually tried to negotiate with BCBS, that's Blue Cross Blue Shield, for months, as did mine. Okay, and we have been in limbo waiting to see if we could continue seeing that doctor. I have called his office weekly for an update. Just found out this morning the doc is sending me a letter this week to cut my family from his practice. Here's another faculty member and friend of mine. I now have to pay up front for my bladder cancer treatments and subsequent procedures. I had to get a revised referral from my PCP indicating that there are no other urology groups in the area, let alone ones that take BCBS in order to justify seeing my urologist. Okay? I then submit my reimbursement request form to BCS and cross my fingers. The treatments and procedures are expensive and add up quickly. BCBS tells me I have to say they were nice to me on the phone. I will likely have to wait over a month for processing and perhaps more than that to see any reimbursement come my way. I was told to keep checking the status of my submission online, and if I did not see progress, I should submit just in case. Okay. Okay. And then, the beat goes on. I'm down to less than 2 minutes, folks, and I could go on with this. Here's another one. I haven't sent DMC emails all in years, but he wanted to share this. The man has his wife is a PCP around here, and she refuses to take it. He's an employee of Del Mar College. So if you would, Porter Wilson is the executive director of the Employment Retirement System of Texas. Okay, and his telephone number, or their telephone number, I had to get it. Okay, it's 1-512-867-7772. I won't even tell you how I was able to get that number into his administrative assistant. Okay, I don't like to give my secrets away on how I can get information out. All right, I'm going to go ahead and call it quits for a short time, I'm going to go over there and show you those beautiful pink flowers. Thank you, Miss Connie and Miss Lynn and Miss April 23 for being such great women. Okay, those women love pink, and especially April 23, so here it is. Enjoy those.